a single plant proven to cure up to 98% of deadly malaria cases for 21 critically ill patients in the Congo. It later earned Tu Youyou the Nobel Prize after her secret work began in 1967. Yet the World Health Organization bans the plant itself, while billion-dollar drug companies profit from its patented extract. Why does a locally grown, gold-standard cure remain off-limits where malaria still kills over 400,000 children every year? The answer threads through war, scientific discovery, and a global system unwilling to let go of control. A plant with the power to cure nearly every case of the world's deadliest parasitic disease is, today, officially off-limits, in the very places where malaria kills the most children. Artemisia annua sweet wormwood holds within its leaves a compound so effective that the World Health Organization calls it the gold standard for malaria treatment. Yet the WHO's own policy forbids the use of the plant itself, warning against teas, powders, or tablets made from its leaves, while promoting only pharmaceutical extracts. In 2015, Tu Youyou, a Chinese pharmacologist, stood before the Nobel Committee in Stockholm, honoured for her role in discovering artemisinin. Her breakthrough came not from a modern laboratory, but from a medical text from 1600 years ago, and a desperate wartime search for a cure. The therapy that emerged now cures up to 98% of malaria cases when used in combination therapies, numbers confirmed by decades of WHO data. But the paradox runs deeper. In the Democratic Republic of Congo, a local clinician faced a ward of dying patients, children and adults who had failed every standard malaria drug, including intravenous artesunate. With nothing left to try, he turned to dried Artemisia annua tablets, pressed from locally grown leaves. 18 patients, including a 5-year-old who had fallen into a coma, received the tablets. Within 5 days, every single one recovered, their blood cleared of parasites. The clinical records and blood smears document a rescue not just from disease, but from the limits of the world's most advanced medicines. How can a Nobel-winning, WHO-endorsed cure be celebrated in one form and outlawed in another? Why does a plant that can be grown in a village garden remain banned where it is needed most? The answers start decades earlier, in a secret military laboratory, with a scientist willing to risk her life for a cure the world would not easily accept. On May the 23rd, 1967, deep inside the machinery of the Chinese state, a secret order launched Project 503. The goal was urgent and clear: find a cure for malaria, the disease crippling troops along the Vietnam border. More than 500 scientists drawn from military, academic and traditional medicine backgrounds were mobilized in a race against death. Among them was a young pharmacologist named Tu Youyou, appointed in 1969 to lead the traditional medicine arm. Her team combed through 2,000 ancient remedies, narrowing the search to just over 600 candidates. The breakthrough came not from modern chemistry, but from a 4th century handbook by Ge Hong. There, Tu found a cryptic recipe for qinghao, sweet wormwood, and a crucial detail: the leaves must be soaked, not boiled, to preserve their healing power. Tu's team refined this ancient method, producing what they called Extract 191. In October 1971, a single test changed everything. Mice infected with malaria parasites received the new extract. Every animal survived. The lab notebooks, preserved to this day, record 100% inhibition of the parasite. But the risks were far from over. Before any patient could be treated, Tu herself swallowed the extract, proving its safety. In 1972, the first human trials began on Hainan Island. 21 patients with severe malaria received the treatment. Everyone recovered. These results, detailed in internal reports and case sheets, confirmed that the cure lay within the plant's leaves. By November of that year, the team had isolated the pure compound, qinghaosu, later named artemisinin, setting in motion a revolution in medicine that began with a secret war, an ancient text, and a scientist willing to risk everything for a cure. In October 1981, Chinese researchers arrived at a World Health Organization meeting in Beijing, carrying clinical records and lab data. They proposed a therapy made from dried Artemisia annua leaves, locally grown, affordable, and already proven to cure severe malaria when other drugs failed. Their plan was to standardize the extract, mass produce it, and distribute it widely. The WHO refused, citing quality control and dose variability, and left the plant off its treatment guidelines. Instead, the organization shifted focus to isolating and patenting artemisinin, the plant's active compound, opening the door to pharmaceutical control. By 1994, Novartis had secured exclusive rights with Chinese partners to commercialize Artemisia lumefantrine, later branded as Quartum. The licensing agreement included technology transfer restrictions, concentrating global supply in the hands of a few multinational firms. Quartum entered the WHO pre-qualification program in 2001. Over 400 million courses have since been delivered to malaria-endemic countries at a not-for-profit price. Yet the same drug, sold as Riamet in Switzerland, costs up to $66 per treatment, while African buyers pay around $2.50 per treatment, a 40-fold difference. Meanwhile, Pamela Weathers at Worcester Polytechnic Institute found that dried Artemisia leaves deliver up to 40 times more artemisinin into the bloodstream than the purified drug, thanks to the plant's natural synergy. Clinical evidence from the Democratic Republic of Congo and elsewhere suggests whole leaf tablets can cure even drug-resistant malaria at a fraction of the cost. Still, WHO policy remains clear. WHO does not support the promotion or use of Artemisia plant material in any form for the prevention or treatment of malaria. Resistance is no longer a distant threat. In the borderlands of Cambodia, Thailand, and Vietnam, the malaria parasite has learned to survive artemisinin-based therapies that once cleared infections in days. Genetic sequencing pinpoints the culprit. Mutations in the Kelch13 gene, first identified in the Greater Mekong subregion, are now spreading across Southeast Asia. These changes slow the drug's attack, leaving patients infectious for longer and giving the parasite time to adapt. In some provinces, up to half of malaria cases show delayed clearance, a warning sign that the world's most powerful antimalarial is slipping from our grasp. The consequences are measured in lives. Each year, more than 400,000 people die from malaria, most of them children under 5 in sub-Saharan Africa. As resistance spreads, the number grows. The cost of treatment rises too. Pharmaceutical therapies are priced at $2.50 per adult course in Africa, and up to $66 in Europe. Local audits show that a full course of dried Artemisia leaf tablets can be produced for less than 5 cents. Yet the cheapest and potentially most resilient remedy remains locked out of official guidelines. Researchers tracking resistance warn that the status quo cannot hold. Molecular surveillance teams map Kelch13 mutations as they leap from village to village, outpacing the rollout of new drugs. Reports from frontline clinics reveal patients returning with persistent fevers, even after full courses of therapies approved by the World Health Organization. The numbers are stark. In 2018, the World Health Organization documented rising treatment failures in all regions where Kelch13 mutants dominate. The search for alternatives is no longer academic. It is a race against time, and the cost of delay is counted in hundreds of thousands of preventable deaths. Across Africa and Asia, the knowledge of Artemisia annua refuses to disappear. In 2002, the World Health Organization's former Director General, Gro Harlem Brundtland, awarded the Prize of Excellence to the Anamed Network for training farmers to grow and process Artemisia with scientific precision. The prize recognized a model that sidesteps the pharmaceutical bottleneck, smallholder fields, local processing, and tablets pressed in community-run centers. At Maison de l'Artemisia in Burundi and Rwanda, technicians follow strict protocols, harvesting at peak potency, drying leaves below 30 degrees Celsius, milling to a fine powder, and pressing tablets with verified artemisinin content. Each batch is tested to ensure the active ingredient falls within 5% of the target dose, matching or surpassing the quality standards of many generic drugs. Audits confirm that a full adult treatment can be produced for less than 5 cents, a price that puts even subsidized pharmaceuticals to shame. These centers don't just produce medicine, they offer a blueprint for self-reliance. The standard operating procedures, refined over years of fieldwork and laboratory testing, are published for anyone to use. Farmers receive training in soil management, seed selection, and organic pest control. The result is a supply chain that begins in village gardens and ends with a tablet whose quality is independently verified. compliant with ISO food safety standards. Anamed's coordinator describes a future where every region threatened by malaria can grow, process, and distribute its own cure. No patents, no imports, no waiting for permission from Geneva. The evidence is clear. Community-led production can meet the highest standards of efficacy and safety. The demand now is for policy to catch up. Advocates call for 3 changes: a formal World Health Organization review of the new data, funding for randomized trials of dried leaf tablets, and a regulatory framework that allows communities to produce and use Artemisia safely. The tools exist. The science is public. What remains is the will to act. Today, over 600,000 people, mostly children, die each year from malaria, while the plant that could save them remains sidelined by policy and profit. Communities are reclaiming knowledge that institutions ignore. The real question is who decides whose lives are worth saving, and what are we willing to challenge to change that?